What's going on? It is Coach James here, back at it again with Convos with Dr. Andy, with Dr. Andrew Moldermans. Now, if y'all are brand new and you don't know who the hell he is, you're wrong. Maybe go back to number one, and we've got probably 30 episodes at this point. Go listen. But today we're going to talk about sleep, and not sleep in the sense that most people do. So most times when you hear, coaches, consultants, doctors, whoever talk about sleep, they're talking about REM sleep, they're talking about duration of sleep, they're talking about bedtime routine, nighttime routine. Today, we're going to actually just break down more of the positional things that you need to be aware of for sleep and how you can get better rest by shifting where your head, your neck, your back, your low back, your knees, and your feet are on the bed to get better sleep there. So first and foremost, kind of break it down with for us, Andy, on maybe the things that you're seeing most frequently that people are struggling with the position in sleep.
I would say a question I get all the time in the office is, hey doc, what's a good pillow? What's a good mattress? What's the best position to sleep? Those are kind of the three most common questions I get, outside of the statements where a patient might come in and they'll have a flare up somewhere, in their predominantly like their spine, neck, maybe shoulder blade area or low back, where they say, I slept wrong, doc. I tweaked something. So that kind of sparked me to come on and talk about this a little bit. So I don't physically see how people sleep. I'm not, watching over them at night, but essentially I get a lot of like, hey doc, I sleep on my side, right? I sleep on this one side predominantly, or I have to flip flop back and forth. I can't get comfortable. And everyone's different. I know for myself, like I'll sleep stomach, sides, back, crisscross, starfish, you name it. But I think a lot of people are looking for this magic, either red pill or blue pill recipe to like, man, give me a better night's sleep. So what I kind of want to talk about, James, is, some people might sleep in a less in a position that may not be advantageous for somebody else, right? So sleep is not, I'd say, ubiquitous.
Yeah.
So, first and foremost, everyone thinks that sleeping on your back, right, is the best way to go. And for the most part, I mean, that's a pretty solid choice, I think, if you're sleeping, especially on a really hard surface, not necessarily like your comfy memory foam. Hopefully no one has a waterbed out there anymore, but for a hard surface, yeah, back is probably your best way to go. But some people do better with stomach. Some people need to do better with side.
Yeah. So regardless of whether they're back, side, stomach, I mean, what is the thing that we're trying to achieve here outside of just a higher quality of sleep and more quantity of sleep? Like, is there a position with the spine or your hips or your feet that no matter what position you're sleeping in there is the advantageous position?
Yes, but it would depend on, I would say, somebody's unique structure to their spine.
Mm-hmm.
So we've mentioned the term lordosis, I think, in past episodes, and kyphosis for people that, haven't gone back and listened to those episodes or don't know what they mean. So lordosis and kyphosis are just curves of the spine. So your neck and your low back should have a lordotic curve, which is like a backwards C. So imagine, I'm going to, paint this example, I guess, but imagine just, for the most part, a female cheerleader where, their low back kind of like indents in a little bit and then their butt kind of goes out, right? It's relatively attractive, I think, for most of the male population, what they're looking for in a female. But anyway, so that's the proper curve of a low back, and also your neck. You should have those two lordotic curves. Kyphotic is just the opposite. So you should have a very, very less minimal, like hunchback of Notre Dame kind of back for the mid back. So anyway, so if somebody has too much curve like that, say in their low back, they have too much of that curve, sleeping on their back is probably not going to be the more advantageous position for them, because it's going to increase that curve. So if you can imagine somebody laying on their back, the heaviest parts of their body are their pelvis. So you can think like their butt area, right? and then their shoulders or their chest. So you can think of like shoulders, lung, heart, all that in your chest cavity. Those are the two heaviest places when you lay on your back. So if those are the two heaviest, those are going to sink down lowest into the mattress, and that's going to increase your low back curve. Okay, if you can visualize that. So for them, sleeping on their side or even sleeping on their stomach might be more advantageous to help reduce the amount of curve in their low back. Because again, two heaviest places, chest and glutes or pelvis. So when they lay on their stomach, those are going to sink down into the mattress, thus flattening your spine out a little bit. The caveat to that, though, is you want to make sure that your neck, obviously, you're not going to be able to sleep head face down neutral because you won't be able to breathe. So neck's going to have to be positioned in a more comfortable way. I would say just make sure that it's a little bit lower than your shoulders. So you don't want to be having it up on a pillow where your neck's in this cranked, extended position while you're sleeping on your stomach. So vice versa, if somebody needs more curve in their spine, right, I would have them sleep on their back for the exact opposite reason what I just portrayed with that example.
Okay. So let's say someone has, man, I've got neck pain, right? I've got, like back of my neck, right? My traps, my upper back, I sit kind of here all the time. Oh man, when I go to bed, when I wake up, I'm super tight there. I mean, what does someone like that need to adjust in their sleep?
I mean, first I would ask them, hey, what position do you normally sleep in? Right. Just to kind of uncover that mystery. And I would, my general parenting answer on that would be like, well, if that hurts it, don't do that. Right. Yeah. So like, let's say they're sleeping on their back, right. And their heads turn to the right and they stay like that. Well, when they get up in the morning after, how many ever hours of being in that position, yeah, you're going to have some tissues being tight. So if you're try your best not to, sleep in the positions that you realize are giving you the issue. That's usually, that is doctor advice, but that's also kind of like common sense advice. Yeah. If somebody, I see a lot of this, I see a lot of people that sleep on their side that end up with some sort of, neck tweak. And I think that's because when they lay on their side, they're not. So for those of you guys that are watching YouTube, you can see James and myself, right? You can see from the shoulders to my neck up to my head, right? That angle is predominantly squared, right? It's typically, me, I don't have a lot of traps. So mine's like 90 degrees. For James, his is more going to be like at 15 degrees. So, but it's a square. It's not circular. So when you're sleeping on your side, you want to maintain that neutrality, right? So if you can picture me, in this position, standing vertical, right? If I tilt my head to the left or tilt my head to the right, and I stay like that for a prolonged period of time, yeah, you're gonna end up causing some muscle imbalances, right? And then when you wake up in the morning, those tissues are kind of tight, but you move anyway. Then yeah, you're gonna end up with a little muscle tweak, right? And that's what I see a lot with like people that can't necessarily turn their neck like they did the day before, right? And then it might bleed down into their shoulder blade area. So if you lay on your side, I would just make sure that you have your pillow or something positioned so that your head is not leaning one way or the other. It's nice and neutral.
Facts. I'm here for that. Now here's a more difficult question. For somebody that's in a position where it doesn't matter if they sleep on their stomach, their right side, their left side, their back, right? With dogs, with no dogs, with partner, with no partner, with this pillow or that Tempur-Pedic pillow or this arm pillow, they still don't get great sleep. Like none of it is painful, but all of it is bothersome. It's not a comfortable position. They're tossing and turning. They're feeling, tightened tissues and tightened muscles as they're, kind of rolling around and can't really get solid quality of sleep. I mean, for somebody that's having kind of presenting problems in all directions there, I mean, what's the recommendation on position to get someone to a better sleep area?
I guess my answer to that one would be, I don't know of any just, hey, try this position. If they're in this state of kind of restlessness, which is kind of like, I think what you described, whether it's not necessarily pain, it's just like, doc, I can't get comfortable. I've had similar nights like that where I just, my body's felt restless and I've had to move. So what I would say for them is typically that could be from, a few different mechanisms, one being you're not in a relaxed state neurologically. So like your brain could be, in ready to go mode, not ready to sleep mode. So I know in our past episode, we've talked about breathing, some of those breathing mechanisms can help lower you down. Right. Two, if you're tight or you feel kind of tight, restless, stretching is great. Foam rolling, those kind of things just help to restore and move some blood flow around. If you're somebody who suffers from what James just kind of alluded to, that restless kind of feeling. I know a lot of people out there deal with restless leg syndrome or something similar to it, right? Where one leg or both legs can't seem to get comfortable. You got to constantly move them around. That's blood flow. So your body's trying to push blood back up to your heart so that your heart doesn't have to work as hard. Because the thing that your heart wants to do at night is it's not going to turn off, obviously, but it should slow down, right? Temperature should decrease as you start to go to bed. So your system should relax just like you. So my advice for that, I mean, figure out if you have any kind of stress in your life that's not allowing you to kind of wind down, right? And attack that. Breathing techniques are great. They're free. They're fairly simple. Yet some are kind of, hard and challenging to do if you've never done them before. Stretch, right? If you don't know how to stretch, there's great YouTube videos out there for stretching anything really that you want. And then, and just doesn't answer your question, but I'm a fervent believer that, quality sleep, I'd rather have somebody get quality sleep in a bad position than get no sleep in the best optimal position. Because at the end of the day, you won't live very long if you don't sleep. So I'd rather have somebody get quality sleep in a less than optimal textbook position than be textbook and not get any sleep at all.
Yeah, no, that makes sense. I think that kind of covers all of the I guess position things as it pertains to sleep. I mean, anything else that we haven't touched on, or anything else that maybe a recommendation that you give to patients when they come in, or if someone is just struggling with sleep overall? Do you think we missed anything?
No, I mean, the big thing is like quality over position,
Mm-hmm.
right? And then if you are struggling with, certain positions, hopefully that gave them a little insight. Hey, go what feels good, right? Like your body's going to be your best interpreter as far as, telling you what it likes to do. So sleeping on your back's uncomfortable. If you're somebody who needs pillows under your knees or bent knees to give yourself relief in your low back, flip over and lay on your stomach, right? And see if that helps. If you're a side sleeper like myself, just make sure that your head is neutral. Make sure that your hips, when I say hips, like your legs, make sure one leg isn't draped over the other one, because that could cause, potential hip pain. So just keep things think of your spine, keep it nice and neutral, right?
Word. Well, cool. We'll end that episode there. I think this was a lot of information on sleep position, and probably way more information than anyone's ever thought about it. So I hope that helps whoever's out there. And if it doesn't, hey, send a DM, hit a text, comment on our YouTube. We're happy to respond.
Yeah, let us know
and help you out with anything. Appreciate y'all listening. Peace.